Do you suffer from neck pain caused by pinched nerves or herniated discs? Well, there's exciting new research being done right now, right here in North Texas to bring relief. Dr. David Rothbart from Spine Team Texas is here with the details. This is really cool stuff. When you were describing it to you this morning, I couldn't wrap my head around it at first, and then when you really explained it, I'm like, this is awesome. But all right, first of all, let's talk about how prevalent this kind of problems are.
Well, Rob, 90% of all adults, it's said, will suffer from back or neck pain at some point in their life. And in our practice, about 40% of patients have pain in their neck, literally.
Now, pain in the neck. So do a majority of those require surgery? How many of those have to move to that extreme?
Absolutely not, and that's the most important message today. I'm a surgeon. I'm telling you, surgery is the last option. For the small percentage of patients that do require surgery, it should be through a latest technique or through minimally invasive procedures.
Well, you mentioned latest technique, and you've got a new technique that you've been working with. So explain to me about this new procedure.
Yes, we're working with a substance called osteocel. We're one of 19 centers in the United States looking at this particular substance, which is a combination of bone and living cells that help your own body heal itself by growing bone and stabilizing the spine.
So your body is able to regrow bone when this is put in?
That's exactly right. We really, at Spine Team Texas, we think the future of spine is really in 3 areas: artificial discs, minimally invasive techniques, and biologics to help the body heal itself.
All right, so how many patients are available for this? What kind of symptoms are you able to use this for?
Well, the typical patient will have symptoms with neck pain, pain down an arm, sometimes numbness, tingling, sometimes weakness. And there's going to be 175 patients enrolled in the United States, and like I said, we're one of 19 centers.
All right, what's the benefit when you use this? Let me get it straight. It's allograft, right?
Right, that's a bone substance, and historically what's been used is doing a separate operation where you have to take a piece of bone elsewhere in the body. Since we stopped doing that, we've been looking for the ideal substance. So this is a combination, like I said, of bone and stem cells, which are cells that induce your body to grow the own tissue, in this case bone.
Where else did they use this before they started applying it for back? I know they've used this in other places.
Right. Well, since 2005, about 35,000 patients have received osteocel, so we were fairly comfortable with the safety, and it's been used throughout the body, so now we're looking at an application in spine.
All right, so if someone is suffering from one of those symptoms you've got, pain in the neck, down the shoulder, some numbness, some tingling, what should they do to find out if they qualify to maybe be one of those folks?
Well, they should contact Spine Team Texas, and we'll screen them. And like we said, just because they call about the study, we will first attempt to treat them non-surgically if possible.
Because surgery is always the last step, and there are a lot of things that you can do along the way. All right, that is really cool. Keep us posted and let us know what happens with this study, yeah?
Will do, Rob.
All right, fantastic. If you want to find out more about this procedure and the use of Osteocel Plus, you can call 817-442-9300. Schedule an evaluation with a spine specialist at Spine Team Texas, and as always, you can log on to spineteamtexas.com. Amy?